Many families in America find themselves struggling to afford health care and keep up with their bills. One example is of the Roberts family, who are paying close to $200,000 per transplant for their child. Robert says, "My husband and I had good salaries. We had double income, no kids for 5 years of our marriage. We had a couple of properties. We had a hefty retirement, a hefty savings." Robert says that's mostly gone and they aren't as stable as they once were. "We're part of a group that makes too much to get state or federal help, and we make too little to pay out of pocket for everything. We're in that dangerous middle ground of families that go bankrupt because of one tragedy that isn't covered."
Hello, I'm Mr. DeToro here at Lakeview High School. I am 38 years old and I identify as a male. I am definitely a proponent for universal health care. I think that everyone should have access um, to preventative medicines, to vaccines, to mental health experts. I think it would make our country an even better place.
Hi, my name is Elizabeth Miller. I'm 35 from Ohio, and I have been extremely fortunate in my life to have good health care as an adult and when I was younger. And that has really helped me in my life on many occasions. But I do know in our society there are many people who lack access to quality health care. And, when you go to receive a doctor, you have a doctor's visit that's like $150. A emergency room visit can be up into the thousands of dollars. Prescription drug costs are in the hundreds of dollars per fill. That is a lot of money for the average American.
"We basically go anywhere from 35,000 to 80,000 in expenses, depending," she says. "We put it all on payment plans. Long after my kids are in college and supporting themselves, I'm assuming I'm going to be paying medical bills," she says. Not having health insurance is simply not an option for them. Before the Affordable Care Act, the family was paying $3,300 a month for coverage through Blue Cross Blue Shield. After the first year of Obamacare, their costs dropped to $1,700 a month, and it saved them $36,000 a year.
I think that everyone in the country having equal access to healthcare would be a great way to improve this current system. Healthcare in America, although a necessity, is very expensive. Not only is healthcare itself expensive, but if you go to the hospital for any reason without insurance, the cost at the lowest triples. The need for healthcare has grown largely, especially in the lower class. Offering the people who could not afford it before equal access to healthcare gives them a huge boost on their financial status and a lessening on their financial struggles.
Healthcare is a really big issue for Americans right now, especially those who don't have a lot of money to pay. And going to the hospital with people without insurance really takes a lot of people's money, and some kind of universal healthcare would really help a lot of people, especially ones in poverty.
This year has been a roller coaster of emotions as she watched Congress propose and then narrowly reject plans that could have sunk her family. If the law is repealed and insurers can charge much higher premiums to people with pre existing conditions, she says it would be catastrophic. Pre existing conditions come back. Boom, we're done, she says. Mental health not covered. Boom, done. Medication changes. Done. "I know something has to be done, I do," she says. "I understand that businesses are in the business to make profits and keep people employed, but I don't think that taking insurance away from the most vulnerable people, the elderly and the sick, is the way to do it. We shouldn't want that." Now, if you would like to help a family like the Roberts family, visit ripmedicaldebt.org. For every dollar donated, it forgives $100 in medical debt, which over 66% of all Americans are tied to. So far, RIP Medical Debt has forgiven over $3 billion in medical debt as of March 31st, 2021. Be the change you want to see.